Mr. Speaker, my question is for the Minister responsible for the Office of Addictions and Mental Health. The Mass Casualty Commission found that support provided to Portapique and surrounding areas was and continues to be insufficient to meet the community's needs. Last year, Portapique resident Leon Jodry told the Commission about his challenges accessing mental health following the events of April 2020, stating, "When you're shaking every day and someone tells you it'll be 3 weeks for help, it doesn't help you much, and I'll table that." Mr. Speaker, this province failed Mr. Jodry and failed the community of Portapique. How is the Minister making sure no Nova Scotian, especially these communities, go without the mental health care they need?
The Honourable Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. I thank the member for this important question. My heart certainly goes out to the families and all those communities impacted. It's something that we'll certainly never forget. Unfortunately, we can't change what happened, so I'm certainly committed to reviewing those recommendations in their entirety. Right now, my senior staff, myself, I know a number of ministers in the government are reviewing those recommendations very, very carefully. And I certainly sense an urgency in the community that needs help from this deep, deep tragedy. So we will certainly continue to monitor that report and give it a thorough evaluation. There'll be more to say in the near future. Thank you, Mr. Speaker.
The Honourable Member for Halifax Citadel Sable Island.
The report also recommends the province, together with the federal counterparts, work to develop an action plan to deliver mental health care at an equal level as physical health care. The report notes the time sensitivity of this recommendation, describing the current situation in Portapique as a public health emergency. As one resident stated, you have to wait months to get into a psychiatrist, any mental health programs that don't cost you money at the hospital, anything like that. Recognizing the urgency of this, will the Minister commit today to tabling this action plan by the May 1st deadline set in the report?
The Honourable Minister for Mental Health and Addictions.
Thank you, Mr. Speaker. I thank the member for the important question. So this is a very significant report that holds a lot of weight for our province and for the country. I do have a meeting scheduled next week to meet with my federal counterpart, and certainly will be an issue that I'll be bringing forward with Minister Bennett. But we will certainly carefully review these considerations. I know the Premier, along with all of my colleagues, are deeply dedicated to this very important issue. Thank you, Mr. Speaker.